You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Today we'll talk about a case I had a few weeks ago regarding a patient. We'll call her Joyce. Joyce was a healthy 25-year-old female. She was 2 weeks postpartum when I saw her in the ER. Postpartum means the time frame immediately after having a baby. So basically she had her baby, everything was fine, no problems during the pregnancy. She stayed in the hospital for 2 nights, which is normal. She was discharged home, and she was breastfeeding her infant. 2 weeks after this, she developed some swelling and redness in her left breast. It was very, very painful. She had a hard time just wearing clothing over that area. Then she developed a fever, and that's when she came to see me in the emergency department because her doctor couldn't see her. She had no discharge, there was no bleeding, but overall she felt very achy, and her baby was continuing to breastfeed, but she became worried if she should continue or stop. I examined the patient with her husband and one of my female nurses in the room, and the left breast was very, very swollen. There was redness, there was inflammation, and it was extremely tender just to gentle palpation or gentle touch. I already knew what the diagnosis was, and I advised her what she needed to do. This patient had mastitis. Mastitis is an infection of the breast. The most common situation is in breastfeeding mothers, and it occurs due to an infection from bacteria. So there's a couple of things that happen in the breast tissue that are unique. The first thing is that there is milk, which is produced, and the milk has its own sugar. So as we know, people who are diabetic have more risk of complications due to infections and the problems with diabetes. In this case, the milk has its own sugar, which attracts infection. The second thing is that in the few weeks after having a baby, there is something called engorgement. Engorgement is where a large amount of milk is being produced and drops down through the breast area into the nipple area. Naturally, the baby will feed left and right, allowing the milk to continue and flowing properly. However, if the baby is not feeding properly, or if there are small breaks in the skin, or if there's any blockage of the milk ducts, then the milk will backflow. Milk that sits for too long attracts infection because it becomes stagnant. And that's what happened in this situation. The mother was actively breastfeeding. She was doing her best to make sure her child was getting enough milk, but unfortunately on one side of the breast, there was a small blockage which caused a backflow of the milk, and the longer it sat there, the more and more sensitive it became. Now, the number one bacteria that causes mastitis is actually staph. So staph bacteria, many people are familiar, it can cause boils. It causes a lot of infections and complications, and it does cause mastitis. In this situation, the patient also had a fever. This is also very common. Many women who develop mastitis will have a flu-like symptom. They'll feel very achy all over. They have difficulty sleeping, and over-the-counter medicines don't really work all that well. The best treatment for mastitis is actually to continue milk production and to continue breastfeeding. As the milk continues to move, the infection will actually clear up if it's a mild one. However, if the infection worsens, then antibiotics are required. Fortunately, common antibiotics, which are safe for the baby, can be used. So the most common antibiotic would be cephalexin, also called Keflex, or another medicine called dicloxacillin, which is a cousin of penicillin. These are both very safe for the baby, and in fact, we recommend that women continue breastfeeding, even from the infected side, because the benefit to the baby is so much greater than any risk from any low-grade infection. Now, mastitis is not contagious, meaning it doesn't go from one breast to the other, and it doesn't spread from the mother to the child or to other family members. It's not that type of an infection. Mastitis can reoccur, and the problem is oftentimes, again, with feeding. So if babies are not feeding properly, or if the mother is not pumping on a regular schedule, or if there's other issues causing blockage, then the mastitis may redevelop. We have to always be careful because at some point, if mastitis is not treated, then the milk production will stop. And unfortunately, on that side, there'll be no further milk, and then it's going to be very difficult to carry on breastfeeding. So we always encourage, especially new mothers and breastfeeding mothers, to be in touch with their family doctor, but also to talk to the lactation nurse. Lactation nurses are hired at every hospital. They are very, very experienced, and they help women who want to breastfeed their children how to do it properly. And I've seen many times children or mothers who have problems in the immediate time after birth will actually call a lactation nurse or talk to them and get some other techniques on what they can do. The most important thing is to continue breastfeeding. Now, there are other situations where there could be a problem when it's not related to breastfeeding. For example, mastitis can occur if there's a tumor or other type of special infection. Could be a side effect from some medication. It could also be a sign of cancer or other serious issues. In those cases, we always recommend a proper physical exam. A doctor may do some basic blood work. They may recommend an ultrasound or some other testing, but those again are a minority of cases. A majority are just going to be from simple breastfeeding. I'll have some information online so that you can read about some of the treatments and recognize the signs of it. So if you or a family member or a coworker should ever have issues with mastitis, you can recognize it, recommend some simple treatment for them, and then have them follow up with their doctor and the lactation nurse as soon as possible. If you have any advice or some general recommendations on home therapies or other experiences with mastitis, please share them with us online, and I'll be sure to include it in our blog. I look forward to having you again on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3&0 Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.